Hi, my name's Dr. Gareth Weston, a fertility specialist in Melbourne with over 20 years' experience. I have practices in the centre of Melbourne, the western suburbs of Melbourne, and in rural Gippsland in country Victoria. Welcome to my fertility channel, where we explore very specific problems in fertility and IVF treatment and look at solutions to some of those common problems. Today I'm going to talk about one of the most common problems that I have with an IVF cycle where patients can get very upset. Remember from one of my previous podcasts that we're aiming for 8 to 15 eggs with an IVF cycle. Today we're going to talk about the patient who is expecting a normal number of eggs, the ideal number being, as I said, between 8 and 15. So their ultrasound before their egg collection, they're expecting that number of eggs on the basis of the number of larger follicles picked up on ultrasound before they take their trigger. You perform the egg collection and they have many less eggs than they were expecting. This is very different from a poor responder. A poor responder is a patient where we're expecting low egg numbers on the basis of their scan, and there we get low egg numbers. Those patients are very different to the patients who are expecting normal egg numbers, have a normal scan with large numbers of big follicles before their pickup, but we get much lower numbers of eggs than expected. Those patients can often be very upset when you come after they wake up after their egg collection and you tell them, "I'm really sorry, we didn't get as many eggs as we're expecting." So you've been very unfortunate and you've got less eggs than you're expecting from the retrieval. What are the potential causes and what are the potential solutions? Because there's only one thing worse than having a problem with your IVF cycle. It's not being able to take charge and be able to turn the situation around in another cycle if you need another cycle. The first issue is inadequate dose of hormone, the FSH or follicle stimulating hormone, which stimulates both the recruitment of the eggs and the development of the eggs over a number of days of injections. Sometimes the eggs are recruited but do not have adequate FSH dose in order to sustain them as they grow through the IVF cycle. So one of the first solutions to improving egg numbers is to increase the dose of FSH to therefore improve the sustaining of the eggs through the entire IVF cycle. The second potential problem is that you may have an inadequate trigger. A single dose trigger may not be enough in order to achieve the eggs that you're expecting. You may need a stronger trigger, a double trigger. The third issue could be that the eggs are actually growing in the follicles nicely, and then they're dying off before you can get to them at egg collection. This is a problem that can often be fixed by adding in, for example, melatonin, an adjuvant treatment as a strong antioxidant to mop up free radicals and prevent premature cell death of the eggs. Or perhaps adding in growth factors such as human growth factor, human growth hormone, to try to improve the survival of the eggs. Finally, you may have eggs there, but they're stuck to the side walls of the follicles, and so you're not retrieving them with a single lumen catheter when you're just suctioning the fluid out of the follicle and not afterwards flushing the follicle to dislodge sticky eggs from the sides of the follicles. This can be easily rectified with a double lumen catheter so that you not only drain the follicle but also flush it afterwards. So are we going to try one, then another to find the solution? Probably not. If we have a patient who has much lower eggs than expected, we're going to probably attack the situation in all 4 ways at once, because you can't afford the time to waste to find what is the right solution. So I would prefer to slightly increase the FSH dose, potentially add in an adjuvant treatment, change the trigger dose, and change the technique using a double lumen catheter. I hope that that information empowers you to be able to get the most out of your IVF cycle and get the right treatment to get the best possible result. If the information I've provided has been useful today, please subscribe to my channel as we explore different issues in IVF treatment in each episode. Feel free to share the information with your friends if you feel that will be of benefit to them as well. Thank you for listening.